Hi there. Thank you for taking the time to watch this brief video of explaining birth anxiety. My name is Morgan McMahon and I'm with IOME, here to teach you what birth anxiety is, what can cause it, and how to decrease symptoms if you're experiencing it. At some point during pregnancy, mothers-to-be tend to experience rising levels of anxiety about labor or birth. You may be excited to meet your baby and look forward to being a mother, but actually having the baby can cause some serious sweats, which brings about some conflicting emotions. It's very normal to feel anxious about giving birth. First-time mamas, even women having subsequent babies, and those of you who are just thinking about starting a family are facing the unknown. So, what is birth anxiety? Let's move on to some signs and symptoms of anxiety during pregnancy. There are a number of circumstances that can lead to stress during your pregnancy, including fluctuating hormone levels, uncertainty about the future, or even just physical discomfort. With that said, other everyday life circumstances can also combine with things previously stated and cause some anxiety as well. Anxiety is the most common mental health struggle, especially for women. It is estimated that women are 60% more likely than men to experience an anxiety disorder over their lifetime. It's hard to pinpoint exactly how common anxiety disorders are during pregnancy, but several studies have shown that many women experience it. So here are some symptoms of anxiety during pregnancy that I'm just going to list off for you. The first one is experiencing frequent sense of panic, fear, or restlessness, feeling over anxious all the time and not being able to control it, feeling irritable or sleeping badly, an inability to concentrate on your day-to-day life, having obsessive thoughts, not enjoying things that used to make you happy, feeling anxious most of the time for more than 2 weeks, having some unpleasant thoughts that keep coming back and you can't control them, or that you find yourself repeating an action such as washing or checking or counting to make yourself feel better. So next we're going to talk about what is a normal amount of birth anxiety to have. Anxiety is not only part of being pregnant, but it's part of being human. We all worry, and pregnancy can often amplify those worries that we have. Some women, especially those who have had previous pregnancy losses, a difficult pregnancy or delivery, or fertility problems, worry whether their babies are healthy. Others might worry about whether they'll be good parents, or how their relationship with their partners will change once the baby arrives, how siblings will react to a new baby in the home, or how financial aspects of having a child can affect the family life. Even if you worry about all of these things, that is normal too. But there's a difference between everyday worrying, like what we have mentioned, and all-consuming anxiety during pregnancy, which is also known as antenatal anxiety. Think about talking to a healthcare provider if your anxiety is preventing you from concentrating, causing you to have trouble functioning, making you extremely panicky, or causing some physical symptoms, including a rapid heartbeat or shortness of breath. Anxiety becomes a problem when the feelings you experience are so powerful that they don't go away, or they start to interfere with your daily life. If your thoughts stop you from doing things that you would normally do, then it could be a sign that you may be struggling with birth anxiety. All right, so why seek help for birth anxiety? Many women are under the mistaken impression that the best way to deal with anxiety is to just struggle through it. But if your anxiety is affecting your daily life, there are a few reasons that it's best to seek help. Although you might tell yourself, I'll just feel better once the baby is here, research has actually shown that women who have anxiety during pregnancy are more likely to have postpartum depression after their baby is born. So although anxiety and depression don't necessarily occur together, they are often closely related. And by learning ways to control your anxiety before your new little baby arrives, you'll increase the odds that you'll be able to enjoy those first few months. So what's next? What should you do if you have anxiety during pregnancy? Talk to your midwife, your doula, a doctor, or us at IOME if you're experiencing any of the symptoms that I previously mentioned, or even if you just want to have a space to talk about the concerns that you have before they turn into anxiety symptoms. So lastly, I'm going to provide you with some takeaways or tips to calm anxiety during your pregnancy. Going to therapy sessions with a counselor is usually the first and the best way to help pinpoint what's causing your anxiety and help to develop a plan and put your worries at ease. In addition, I will give you some brief tips here, just an overview of things that can alleviate some anxiety and also help you in the meantime. You can also check out more details on our blog about what I'm about to go through here. So the first tip that I'll provide you with is just to get more sleep when you can. Also to eat whole, fresh foods and to stay active. Something as quick as even a 10-minute walk can help decrease levels of tension and anxiety. Next is just arm yourself with knowledge. Learning the ins and outs of pregnancy and parenting can go a long way in helping you feel prepared and reduce feelings of anxiety. Building a support system is also really helpful. And lastly, just to schedule some time in your day to relax. It's been found that regular meditation and acupuncture have benefits for people with anxiety, or you can even try yoga, listening to music, or get a massage from a professional, or even just see if your partner can do that for you as well. And we're more than happy to have you here at IOME to talk through some of your concerns and help you find a way to engage in some guilt-free self-care. So lastly, try to learn to remind yourself that you really will know what to do once your bundle of joy arrives. Even if you've never held a baby, instinct is on your side. And what your little one will really need more than anything in those first couple weeks of life is just simply your love. If you feel you are struggling with anything that I have discussed in this video today, know that you are not alone. And please feel free to reach out for support because we are here to help you navigate this journey that you're on. Again, my name is Morgan McMahon with IOME, and I really appreciate your time watching this video today.